Hello, my name is Dumebi and today I'll be talking about feeding therapy. By the end of the video, you should know if your child requires feeding therapy or not. Now, feeding therapy is what the name says it is. It's therapy to help children feed. So in feeding therapy, babies and toddlers are taught how to eat properly, how to eat better. You have children that are eating but have trouble eating. They are not eating as they should. Possibly having trouble chewing, swallowing, biting, drinking. So feeding therapy would help babies and toddlers learn how to eat properly, bite properly, chew properly, swallow properly, and even drink properly. Depending on the needs of a child, feeding therapy could either be physical or psychological, carried out by a pediatrician, an occupational therapist, or a speech therapist. A pediatrician, an occupational therapist, or a speech therapist. So a speech therapist, for instance, I'm a speech therapist. I can carry out feeding therapy because feeding and speech have similar oral motor skills. So therefore, a speech therapist can carry out feeding therapy. Apart from helping healthy babies or healthy toddlers to eat, there are other sets of children that may require feeding therapy. And these are children, for instance, you have children that have neurological disorders would need feeding therapy. Examples, children that have autism, children that have cerebral palsy, children that have Down syndrome, children that have sensory processing disorders. These children would require feeding therapy. Children with low muscle tone would also require feeding therapy. Another set of children that will need feeding therapy are picky eaters. Now, for picky eaters, because we meet children, we meet parents and they say, oh, my child needs feeding therapy, he's a picky eater. It's not every picky eater that requires feeding therapy. We look at extreme cases. Basically, if your picky eater has about 9 different meals in his full diet, then he doesn't need feeding therapy. So we are talking of extreme cases where your picky eaters maybe have only 2 meals in their diets or 3 meals in their diets. Anything less than 7 to 9, we consider it extreme. So if your picky eater has about 7 meals, he's comfortable eating, then we allow you to give time and be more patient with introducing new food to your child. So you count it on your finger, picky eaters. My child is having rice, 1, eating beans, taking eba, that's gari and banga soup, for instance. Is taking bananas, eating eggs, takes bread, fish. So you count it up to 9, 7 to 9. If it's 7 to 9, then you don't need to meet a speech therapist or go for feeding therapy for your child. If it's less than that, then you can meet a speech therapist. I'm just saying speech therapist. Then you can meet a speech therapist or an occupational therapist to help in feeding therapy. However, you cannot meet a therapist, an occupational therapist or a speech therapist without recommendation from your pediatrician. That is a must. It's very, very important. Please, before you book an appointment, ensure that you have a referral from your pediatrician. Most pediatricians are hands-on actually, so they would help with the exercises and routines to help your child feed. And those pediatricians that are not so hands-on would say, okay, you can go and meet a speech therapist and occupational therapist and give me feedback over time. All right. So now there are red flags to look out for to determine if your child needs feeding therapy or not. If your child is vomiting when eating, gagging when eating, if your child is not gaining weight appropriately, if your child throws tantrums during meal times, then yes, your child needs feeding therapy. If your child is vomiting and gagging at the sight of food, not even when eating, then your child needs feeding therapy. If your child is reacting to some colors of food, like you have children who vomit at the sight of certain colors of food or certain textures of food, then that child needs feeding therapy. If you have a picky eater on the extreme end, then your child needs feeding therapy. If your pediatrician notices that the meals that your child is taking is not giving enough nutrients, he's not taking in enough meals to give him the necessary nutrients, then your child would also need feeding therapy. But again, it's on the recommendation of your pediatrician. Now, feeding therapy is very beneficial, very, very beneficial to your child. If your pediatrician has recommended that your child go for feeding therapy, go for it actually. It will help your child. You'll see progress. Your child's eating habits would improve. But it's not a fast process. It can be very slow, very, very slow. But in the long run, it will help your child. For extreme picky eaters, you should know that you have to introduce food in 13 variations before they allow the food to be integrated into their meal plan. So if you have rice, for instance, it means you have to introduce rice in 13 variations. Your child may accept it before it gets to the 13th, but the average point is 13. That means rice should be introduced, jollof rice 1, second variant, rice and stew, third variant, rice and banga, fourth variant, coconut rice, fifth variant, fried rice, sixth variant, asun rice, seventh variant, rice and spaghetti, and you go. So the chances are, by the time you get to 8 or 9, the child will have accepted the meal or not, and you keep trying until you get to the 13th. Then you now try another set of food. So it's a process, so that's just to give you an example of how slow it can be, but it is very, very beneficial, and you will see results. So therefore, if you tick all the points I have mentioned and you think that your child needs feeding therapy, speak to your pediatrician, tell him your worries, share your worries with him, and then allow him to recommend the best option for your child. Don't just go and meet a speech therapist or an occupational therapist. Chances are you might not even need us in the whole picture at all. Alright, so speak to your pediatrician, speak to him, tell him your fears, your worries concerning your child, and then allow him to walk you through from there. Alright? Thank you for listening. It's a brief video. Bye.